Obesity doctor and life coach here. I solved the mystery of weight gain and menopause, and I'm going to tell you about it here. So, quick story, I was giving a presentation the other day, and after the presentation, a bunch of people came up to talk to me afterwards, and they all actually, it was kind of funny, they all had the same question. Their question was, hey, what can I do about weight gain in menopause? And for actually all of them, they were all on a weight promoting medication that they had started around the time of menopause. So if you are worried that you have gained weight in menopause, a lot of times what happens, because menopause causes a shift in how the weight is distributed, but it's not like here's an automatic 20 pounds, okay? So, and I've made a lot of videos about this, so if you go to my channel, they are there. But what does happen a lot for women in menopause is they are also started on a medication to help with symptoms. And a lot of times it's not a hormonally based medication. So although a lot of times people do start on estrogen and progesterone, and those really shouldn't be weight promoting. But this is about the time when people might start on something like Effexor or venlafaxine or sertraline, which is also called Zoloft. These are antidepressant, anti-anxiety medications that actually for some people really do help with the symptoms of menopause, but they can actually be weight promoting for some people. And so, but it's very sneaky. And so what happens is people start the medication, they start to feel better. And then 2 years later, they're like, hey, where did this extra 12 pounds come from? And if you go back, I cannot tell you how many times this has happened. We can trace the start of their weight gain to the month that they started that medication. I am not telling you, don't start the medication, but just know that if you already started one and you can't figure out why you can't lose weight, talk to your doctor about that being a potential culprit. And oftentimes if you stop it, the weight doesn't actually come off. But talk to your doctor about that being a potential culprit. If you are in that perimenopause phase and you're on the fence about maybe starting something like that, consider all your options, okay? Because there's a very good chance that it could also come with some unintended weight gain as well. If you're not subscribed already, subscribe, because this is the place for medically based answers to your weight questions.